5 health checkups you should avoid after 70 that may harm you more than help. There's a powerful truth many older adults never hear, not from their doctors, not in health brochures, and certainly not during their checkups. Each year, countless seniors go through routine medical screenings, thinking they're protecting their health. But what if I told you that some of these standard tests, the ones most doctors recommend, could actually increase your risk of surgery, stroke, or even cancer? Recent studies now show that nearly 37% of screenings in people over 65 lead to unnecessary procedures, side effects, and in some cases, lifelong complications. Even more concerning, 99% of those over 70 are completely unaware they're being overtested. One routine exam, the top one on our list today, has been linked to 5% of all cancer diagnoses in the United States. That's the same number of cancer cases tied to daily alcohol use. You won't hear this at your clinic, it won't appear on health posters, but the truth lies in the science, and today we're bringing it into the light. In this video, we're uncovering 5 health checkups to avoid after 70 and revealing the shocking consequences they could have on your health, all supported by real medical research. And you won't believe what came in at number 2. Before we dive in, let us know in the comments, where are you watching from? How old are you? And have you ever had a test you later regretted? Do you think older people are sometimes tested too aggressively? We respond to every single comment with tailored tips and suggestions. Let's get into it. Number 5, bone density scans. On the surface, a bone scan seems harmless. No pain, no poking, just a quick scan that shows how strong your bones are. It's called a DEXA scan, and it's commonly used to check for osteoporosis. But after age 70, this test can often do more harm than good. Here's why. Bone density naturally declines as we age. It's as normal as wrinkles or gray hair. Yet the DEXA scan almost always picks up on this normal decline and labels it as osteopenia or mild bone loss, even when there's no real danger of a fracture. As a result, many seniors are prescribed bisphosphonates, drugs designed to prevent fractures. But these medications carry serious risks, such as jawbone decay, a condition called osteonecrosis, acid reflux, and irritation of the esophagus. The real issue? For most older adults, these drugs don't make much of a difference. A long-term study from the Journal of the American Geriatric Society tracked over 1,200 women aged 70 and above. It found that bisphosphonates reduced fracture risk by just 0.3% over 5 years. That's a very small benefit, especially when weighed against the potential side effects. Let me share the story of Elaine, a 75-year-old former art teacher. She had never had a fall, walked daily, and felt healthy. After her routine checkup, her doctor ordered a DEXA scan, which showed osteopenia. She was immediately put on alendronate, one of the most commonly prescribed bone drugs. Within weeks, she developed severe heartburn, pain in her jaw, and trouble sleeping. She stopped going on walks and skipped her art classes. When we met her, she hadn't painted in months. We took a different approach. We discontinued the medication and helped her start a routine of resistance training, vitamin D supplementation, and a mineral-rich diet with leafy greens, tofu, and sardines. Within a year, Elaine had better balance, stronger legs, and was back to painting with no fractures. For people over 70 who haven't had a fall or fracture, the best defense is lifestyle, not drugs. According to a 2022 study in Osteoporosis International, simple measures like strength exercises, vitamin D, and fall prevention can cut fracture risk by more than 20%. Don't let a scan result frighten you into taking treatments that offer little real benefit. And, as we'll see next, some scans can lead to even scarier outcomes, like unnecessary brain surgery. Number 4, brain MRI for memory issues. It's natural to worry when you start forgetting names or losing your train of thought. For many older adults, these changes spark fear. Fear of Alzheimer's, fear of dementia. So doctors often order a brain MRI, hoping to find answers. But here's the uncomfortable truth. In people over 70, most MRIs simply show normal signs of aging, small spots, slight shrinkage, or changes in white matter. These aren't signs of disease. They're expected with age. Still, once these abnormalities are found, they can lead to a spiral of more tests, more worry, and sometimes invasive procedures, even brain surgery. And in many cases, these interventions don't help memory and can even make things worse. Stay tuned as we explain the other 3 checkups that sound helpful but may quietly be doing more harm than good. In 2021, a report in Neurology Insights analyzed over 3,000 MRI scans from individuals aged 70 to 85 who had mild cognitive concerns. Shockingly, 86% showed some kind of abnormality in the brain, yet only 3% of these results were tied to a real, treatable condition. In other words, 97% of people endured the stress of being told something was wrong when it actually wasn't. Even more troubling, nearly 12% underwent invasive follow-up procedures like lumbar punctures or even brain biopsies, all based on vague MRI findings. Take Frank, a 74-year-old retired architect, who came in worried about occasional forgetfulness. He was mentally sharp, but admitted to misplacing his phone and occasionally forgetting people's names. His doctor referred him for an MRI, which revealed white matter changes. Frank panicked, convinced he was developing dementia. He stopped driving, skipped church, and withdrew from social life. Over the next few months, his anxiety only grew worse. Eventually, we performed a standard cognitive screening, and Frank scored comfortably within the normal range. We explained that the MRI findings were completely typical for his age. Instead, we helped him focus on sleep, hydration, and mentally stimulating activities. Within 3 months, his memory was steady, and he felt like himself again. The reality is, unless someone is showing severe neurological symptoms, like seizures, major personality shifts, or a rapid decline in daily function, MRI scans are rarely helpful in cases of mild memory issues. A much better starting point is a cognitive screening test, a simple, low-cost paper exam that evaluates memory, attention, and problem-solving. It's efficient, avoids panic, and often provides clearer answers than expensive scans. Now, brace yourself. The next test we'll talk about is one many older adults have already done, and there's a reason it lands at number 3. Number 3, the cardiac stress test. One of the most frequently ordered tests for older adults reporting mild fatigue, chest tightness, or just not feeling like they used to. The cardiac stress test monitors your heart while you walk on a treadmill or receive a medication that simulates exercise. Its goal is to detect blocked arteries. But for people over 70, especially those without strong symptoms of heart disease, this test can do more harm than good. Why? Because it produces false positives far too often. In fact, research shows that in seniors over 70, the false positive rate for stress tests, where the test suggests there's a problem when there isn't, can be as high as 40%. These misleading results lead to follow-up tests like angiograms and even unnecessary stent placements or bypass surgeries. A major study published in JAMA Cardiology in 2017 revealed that more than half of the stents placed after a stress test were in patients who had no symptoms and gained no survival or quality of life benefit afterward. What they did experience was increased risk, bleeding, kidney damage from contrast dye, and extended hospital stays. This happened to Walter, a 75-year-old retired bus driver who kept active by walking daily. At a routine visit, he mentioned he felt winded when walking uphill. His doctor ordered a stress test, just in case. The results were inconclusive, so Walter was sent for a catheterization, where a tube is inserted into the arteries to check for blockages. They found a mild narrowing and placed a stent. That same night, Walter had an adverse reaction to the contrast dye and developed kidney complications. He spent 6 days in the hospital and required weeks of follow-up care. Worst of all, his fatigue never improved. Why? Because his heart wasn't the issue. He simply needed more fluids and rest between meals. So, if you're over 70 and don't have classic cardiac symptoms like chest pain with exertion, breathlessness, or extreme fatigue during light activity, a stress test may do more harm than good. A safer option is often a resting EKG, a test that evaluates heart rhythm at rest, or a coronary calcium scan, which uses minimal radiation to detect plaque buildup. These tests are less invasive and far less likely to send you down the wrong medical path. Number 2, colonoscopy. You might not expect to see this here, but colonoscopy, the procedure that uses a camera to examine the colon, isn't always the best option past age 70 and is almost never advised after age 75 unless there are strong symptoms or family history. The risks increase with age. Preparation for the procedure involves powerful laxatives, which can cause dehydration, dizziness, or kidney strain. The sedatives used during the procedure pose added risks to cognitive health in older adults. And perhaps most surprising, the procedure itself isn't without danger. It can lead to bleeding, colon perforation, or even heart rhythm problems caused by the sedative. A 2019 analysis published in JAMA Internal Medicine tracked more than 1.3 million Medicare recipients aged 70 and above. The researchers discovered that for every 1,000 colonoscopies performed in patients over 75, only 2 lives were actually saved, yet over 20 individuals suffered major complications. That's a risk-to-benefit ratio of 10 to 1. Even when polyps are detected, many are so small and slow to grow that removing them in older adults can sometimes do more harm than good. Margaret, a 73-year-old grandmother who ran a family cafe with her son, had no digestive symptoms, no rectal bleeding, normal bowel movements, and no family history of colorectal cancer. Still, her newly assigned physician, fresh out of training, strongly recommended she undergo a routine colonoscopy. She agreed. During the procedure, a minor polyp was excised, and she was discharged later that day. That evening, however, she experienced sharp abdominal pain and collapsed. At the emergency department, doctors diagnosed her with a perforated bowel. She spent 9 days in the hospital, lost over 10 pounds, and has struggled with her health ever since. When her medical history was reviewed, it was found that Margaret had already undergone 2 clean colonoscopies in prior years. There was no clinical need for another. The U.S. Preventative Services Task Force currently recommends halting routine colon cancer screening at age 75 for most adults. For those in very good health, non-invasive options, such as the fecal immunochemical test, FIT, which can be done at home, may be a safer alternative. This test requires no bowel preparation, no anesthesia, and is effective in detecting many significant issues. It's important to discuss these alternatives with your healthcare provider because once you're funneled into the colonoscopy system, it can be hard to opt out. Number 1, annual full-body CT scans. Now let's talk about what is arguably the most misused, potentially hazardous, and overly recommended health screening for seniors. One you've likely already had, the annual full-body CT scan. Full-body CT imaging, often included in premium executive health packages or offered by private wellness clinics as a preventative option, is promoted as a tool to catch serious illness before symptoms arise. But here's the alarming reality. These scans expose the body to high doses of ionizing radiation. For people over 70, this carries an increased risk of triggering unnecessary follow-up procedures, including more scans, invasive biopsies, and even surgeries. Ironically, there is no conclusive evidence that routine full-body scans in asymptomatic individuals actually prevent disease or extend life. Each scan delivers between 10 and 20 millisieverts of radiation, the equivalent of about 500 chest X-rays. According to a 2023 modeling study in JAMA Internal Medicine, the surge in CT scan usage in the U.S. may now account for up to 5% of all cancers. That places scans in the same category as alcohol in terms of cancer risk. This means that 1 out of every 5 cancers might be caused by a scan meant to detect cancer, a deeply unsettling irony. The problem is that these scans often pick up harmless age-related findings, small nodules, benign cysts, calcium deposits, but once spotted, these incidental findings trigger alarm. What follows are more tests, sometimes painful biopsies, and unnecessary stress. Consider the case of Leonard, an 80-year-old retired teacher who enjoyed leading senior fitness classes. He felt healthy and signed up for a comprehensive wellness assessment at a private clinic. The full-body scan revealed a tiny 3-millimeter nodule in his lung. This led to referrals to oncology, a PET scan, and finally a needle biopsy. The result? Non-cancerous. But during the biopsy, part of his lung collapsed, sending him to the hospital and requiring 2 months of recovery. All of this for something that posed no threat to his life. Today, experts strongly advise against using full-body CT scans for general screening in adults with no symptoms. The American College of Radiology has been clear. There is no proven benefit, and the potential for harm is significant. Of course, if someone has symptoms, unexplained weight loss, coughing up blood, a noticeable mass, then targeted imaging makes medical sense. But scanning the entire body without a clear reason is like using a metal detector in a minefield. You might uncover something, but the danger could be far worse than what you are trying to prevent. The smarter, safer approach: pay attention to your body. If you're feeling well, maintain regular checkups with your physician and focus only on tests that are clinically indicated. Not everything that can be found needs to be found. Your health, time, and energy are far too important to be spent on fear-based tests that might leave you feeling worse than before. So, there you have it. 5 medical exams that might appear helpful but could actually cause harm, especially if you're over 70. Modern medicine can do incredible things, but it's not without its flaws. In some cases, doing less can actually be the smarter approach. Always take a moment to ask, what's the next step? If a test detects something unclear, or if the potential harm outweighs the benefit, it might be wiser to hold off. And don't forget, true prevention begins with the choices you make every day. Keep moving, eat nourishing foods, get restful sleep, and choose your medical checkups carefully. Now, we'd love to hear your story. Have you or someone close to you ever experienced side effects or complications from a medical test or treatment that turned out to be unnecessary? What was the outcome? Please share your thoughts and experiences in the comments below. We're eager to hear them. Thank you for watching.